Hello everyone, welcome to FMT Guru. So we are going to discuss death certificate, how to write death certificate and COVID-19 in MCCD. What is MCCD? Medical Certificate of Cause of Death. We are going to discuss 10 examples. Yes. What is MCCD? MCCD means Medical Certificate of Cause of Death. So, cause of death. For hospital death, you must use Form 4. For non-hospital death, you must use Form 4A. Death certificate has two parts. So what are the two parts? It has two parts actually. Two parts are Part 1 and Part 2. Part 1 and Part 2. Again, Part 1 is divided into 1A, 1B, 1C, sometimes 1D also. So, 1A, 1B and 1C. Sometimes it can be 1D also. What is Part 1? Part 1 that contain immediate causes or antecedent causes. Antecedent means come before. What is 1A? 1A, it is the immediate cause. That is, it can be a disease, it can be an injury, it can be a complication of the disease. Complication of the disease that comes under 1A. What is 1A? Immediate cause of death. Like example in COVID-19 cases, respiratory acidosis as a result of ARDS is an example for 1A. So 1A, remember, always there should be entry in 1A. So always there should be entry in 1A. So 1A, one entry, there should be one entry, not multiple entries, only one entry, which leads to immediate cause of death. Always entry, this entry should be there in the certificate, always entry. Avoid mode of dying like respiratory failure, cardiac failure, like that. Avoid mode of dying. Okay, 1A. What is 1B? 1B, antecedent cause. Antecedent means come before. Come before to the immediate cause of death. In respect to what? Time. In respect to what? Pathogenesis. In respect to etiology. That is antecedent 1B. 1C, main underlying cause. Main underlying cause. 1C, main underlying cause. So, like example, COVID-19 is a main underlying cause. So, this is also known as essence of death certificate, commonly asked in NEET exam. Okay? Yes. Now, what is 2? Part 2, other significant conditions contributing to the death but not related to the disease or condition causing it. Like example, alcohol, smoking history, environmental factors, history of some surgery or some iatrogenic underlying cause. So, contributory condition Other significant conditions comes under part 2. So once again I'll repeat, there are two parts are there, part 1 and part 2. Part 1 again classified into 1A, 1B and 1C. 1A immediate cause of death, 1B antecedent cause that come before the immediate cause, 1C main underlying cause, it is also known as essence of death certificate. Part 2 other significant conditions, like example diabetes mellitus, hypertension, alcohol, smoking and all. Form number 4 for hospital death, Form 4A for non-hospital death. Interval also can be mentioned, approximate interval also you should mention. There are two questions commonly asked in exam. One is, what if there is only one condition? Consider there is only one condition. What to do? If there is only one condition leading to immediate death of the person, then you can mention in 1A. Just mention in 1A. Mention in 1A. One more question. What if there is only one condition antecedent to immediate cause? Only one condition is there which is antecedent to immediate cause. Then you can write 1A, 1B and 1C can be kept blank. Okay, 1C can be kept blank. Okay, then death certificate. So the act related to death certificate is the registration of birth and death, that is Births and Deaths Act 1969. So according to this act, no fee should be taken by the medical practitioner while issuing death certificate. Okay, so yes, let's see now some examples. We are going to discuss 10 examples in 5 minutes. So one simple example we'll discuss. So one case of COVID-19 death. So COVID-19, you can see here COVID-19 is the main underlying cause here. Yes, that leads to acute respiratory distress syndrome, that is known as ARDS, leads to respiratory acidosis. That's why it is 1A, 1B here and this is 1C. So the sequence is correct. The sequence of mentioning 1A, 1B, C, that is should be correct. Here also you can see here interval 2 days, 3 days, 7 days. And also you can see here one more, U0 7.1. What is that? U0 7.1. That is a ICD code, International Classification of Diseases, ICD code. So for those patients COVID virus identified, when COVID virus identified, then it comes under U0 7.1 ICD code. Simple example we discussed the first one. Second example, again a case of COVID-19 case, but test is negative, but COVID-19 suspect. So you can see here COVID-19 suspect. So because of COVID-19 suspect, there were some symptoms of influenza-like symptoms. Influenza-like symptoms were there. So that comes under 1B, and because of that there is a ARDS, acute respiratory distress syndrome, that is 1A. So you can see here U0 7.2, U0 7.2, that is for when COVID virus is not identified, or probable COVID-19 patient, or suspected COVID-19 patient, are test negative but clinically, epidemiologically diagnosed case of COVID-19. Just a minute. Yes, you can see here 7.2 COVID virus is not identified, but there is a probable COVID-19, suspected COVID-19, clinically, epidemiologically diagnosed case of COVID-19. You can mention U07.2. This is the second example. Third example we are going to discuss is death due to IHD, that is ischemic heart disease. Let's see now. So here, look at this. The patient is suffering from chronic ischemic heart disease, that is 1C. Main underlying cause leads to acute myocardial infarction. 1B, antecedent cause, and this leads to pulmonary embolism. So this is the immediate cause of death, that is 1A. What other contributory condition or significant condition? Non-insulin dependent diabetes mellitus, obesity, hypertension, congestive heart failure, all comes under part 2. This is a simple case. Fourth one, death due to peritonitis. So cause of death, immediate cause is peritonitis. Why there is a peritonitis? Perforation of the duodenum. Why there was a perforation? Because of duodenal ulcer. You can see here, this is how it should be the sequence. And patient also is having carcinoma bronchus, that comes under part 2. So case of peritonitis. Okay. Then death due to gunshot wound. Death due to gunshot wound. You can see here there is an entry wound over the left side of the chest. Let's see now what are the findings in this. Gunshot wound to the thorax, it comes under 1C. So because of that, there is a perforation of heart, and the perforation leads to cardiac tamponade. So 1A is cardiac tamponade, immediate cause of death. 1B, perforation of heart. 1C, gunshot wound to thorax. Case number 6. A case of bronchogenic carcinoma and death. Now here see, there is a death certificate given which is incorrect. What it is given here? In part 1, 1A it is given primary bronchogenic carcinoma of right lung. 1B, emaciation given. 1C, metastasis to lymph nodes and liver. See how this is logically by sequence it is incorrect only. How metastasis leads to emaciation, how emaciation leads to bronchogenic carcinoma. So this is incorrect certificate. So what should be the correct certificate here? So 1C should be bronchogenic carcinoma. Yes, bronchogenic carcinoma leads to metastasis, leads to emaciation. So emaciation word should be avoided. So this is the correct sequence. Okay. Let's see one more case, 7th. Case of gangrene of foot. Here a patient died due to gangrene of foot. He was suffering from carcinoma of pancreas. So let's see now what is given here. Incorrect certificate. Here given 1A is diabetes, 1B gangrene of foot, 1C carcinoma pancreas and chronic bronchitis. You can see here this is incorrect certificate. What should be the correct here? So he was having carcinoma pancreas. Because of carcinoma pancreas he developed diabetes mellitus. Because of diabetes mellitus he developed gangrene of the foot. So correct should be carcinoma pancreas leading to diabetes, leading to gangrene of the foot. Chronic bronchitis should be in the part 2, is a other significant condition. Okay. Then 8th one. Again incorrect certificate. A patient who died due to uremia. Case of uremia. Here you can see part 1 is retention of urine with hypertrophy of prostate and uremia. B, cataract, and C, ischemic heart disease. It is definitely an incorrect death certificate. What should be the correct? I am going to discuss here. So he was having uremia. Yes, uremia is the 1A. Why uremia? Uremia because of retention of urine. Why retention of urine? Hypertrophy of prostate. And cataract and ischemic heart disease should come under part 2. Okay. So, and one more example, only example I am going to discuss here. Here look at this, a patient who died due to HIV related disease. Okay, the report given is that is death certificate given is HIV, pneumonia due to Klebsiella, septicemia. So here it is wrong actually. This is wrong. This is wrong. So what should be the correct? So because of HIV, that is 1C, 1C, that is correct, 1C. Because of HIV, opportunistic infections like pneumonia due to Klebsiella, then leading to septicemia. So this is the correct sequence. Last example, case 10, that is a renal failure. Renal failure due to polycystic kidney disease. So here given is polycystic kidney disease, wrong it is. Renal failure, wrong. Ischemic heart disease, wrong. So what should be the correct sequence, logical sequence here? I am going to discuss here. So this is a case of renal failure. Why renal failure? Renal failure because of the hypertension. Why there is a hypertension? Because of polycystic kidney disease. And there is a other significant condition, ischemic heart disease. Okay, so 10 examples. Now look at this. So this is the form 4 of the MCCD. What is MCCD? Medical Certificate of Cause of Death. It is for hospital death. Form 4A for non-hospital death. Non-hospital death. So once again I'll repeat. Death certificate has two parts. 1A, 1B, 1C, and also it has second part that contains other significant conditions. 1A, immediate cause of death. 1B, antecedent cause lead to immediate cause, and 1C, main underlying cause, that is also known as essence of death certificate. Thank you. Happy reading.